Today is the third and last topic of neonatal resuscitation, and after we have discussed neonatal resuscitation in detail, today we will be discussing the algorithm, because after this detailed discussion you will be able to understand algorithm in a better way, right? So there are 3 steps which you need to do before birth. Let us say you are posted in the maternity ward and delivery is going to take place. So before delivery, what you will do first is the antenatal counseling. You will counsel the parents and the mother about the delivery, and you will motivate the mother for KMC, that after delivery we will be starting the KMC and that she should be also ready for breastfeeding. So second is a team briefing. Let us say you are 2 persons, you should be clear what one will be doing and how the other person will be helping you. Let us say, for example, you are putting the endotracheal tube, and after that you want to listen to the chest expansion, chest sounds on both sides. Then he will, or we automatically knowing that stethoscope is to be put on and sounds to be listened on both sides. So this type of briefing, already those who are already doing, they have already tuned with each other, but if there is a new person, you need to brief him. Third is the equipment check, that this also should be done prior hand. Now let us say the delivery has taken place. Now what you will do, you will be asking 3 questions. Is it term, right? Is the tone good? Is the cry good? Is the child is meconium stained or child is pink? Let us say, is the child term? Yes. Tone? Yes. Okay. Then what you will be doing? You will be doing the routine care. So as the child has already crying, tone is good and child is pink, child has started breathing. What is the routine care? You will dry up. You will provide warmth under the infant warmer and clear the airways. डिलीवरी होगी तो आपने क्या करना है, ये 3 काम है जो रूटीन में करने हैं ताकि बच्चा अपने आप आगे सांस लेता रहे. There is one step, delayed cord clamping. This has been already taught to you also, that the cord clamping is delayed for 60 seconds. This helps in correcting the anemia in the newborn. But sometimes it can have that a child may be getting polycythemia, or chances of jaundice may also increase. But these days delayed cord clamping is practiced. Now let us say out of these, all is not okay. The child is not crying, or the tone is not good, the child is not term, child is not pink yet, right? हो सकता है ना. एक तो है कि ये सभी ओके है तो आप ये करोगे. अब इसमें से कुछ भी ओके नहीं है तो आप क्या करोगे? यू विल डू दिस, यू कैन रिमेंबर दिस, TSPS. You will try to maintain the temperature. Secondly, you will do stimulation. हमने डिस्कस किया है थ्योरी में, स्टिमुलेशन बच्चे की बैक के ऊपर और सोल्स के ऊपर रबिंग करनी है, जेंटल रबिंग, सो दैट इट स्टार्ट्स टेकिंग ब्रेथ एंड स्टार्ट्स क्राइंग. यू विल पोजीशन क्या होगी बच्चे की? स्लाइटली एक्सटेंडेड. You will place a small roll under the shoulder and you will do suction, right? यहाँ पे हमने क्या किया था, क्लियर किया था एयरवेज को विद द स्टेराइल गॉज. नाउ टू मेक द airways clear, if secretions are more, then you can do suction. That we have already seen, suction catheter and suctioning machine already discussed, right? So इतना करने से क्या हो सकता है कि बच्चे ने ब्रीदिंग शुरू कर दी, क्राइंग शुरू कर दी उसने, हार्ट रेट उसका 100 से ऊपर हो गया, द बॉडी हैज़ बिकम पिंक एंड टोन हैज़ इम्प्रूव. हो सकता है कि इतना करने से ही बच्चा ये कर. सो देन यू विल गिव ओनली स्पोर्टिव केयर. इज इट क्लियर अप टू दिस? इफ इट इज़ क्लियर आई विल गो हैड. इफ एनी वन वांट्स आई विल रिपीट इट आल्सो. सो नाउ लेट अस से इन स्पाइट ऑफ डूइंग ऑल दिस, टेम्परेचर भी आपने मेंटेन किया, उसको स्टिमुलेट भी किया बच्चे को, उसको पोजीशन भी किया, सक्शन भी किया, स्टिल these parameters they have not improved. Then what you will, breathing, अभी भी ब्रीदिंग शुरू नहीं हुई, चाइल्ड इज इन एपनिया, हार्ट रेट उसका पिकअप नहीं हुआ, लेस देन 100 है. दैन व्हाट यू विल डू, पॉजिटिव प्रेशर वेंटिलेशन, जो हमने डिटेल में कल डिस्कस किया है. यू विल बी गिविंग बैग एंड मास्क वेंटिलेशन, राइट. बैग एंड मास्क वेंटिलेशन के इन स्पाइट ऑफ दैट इट इज़ स्टिल बिलो 60. देन व्हाट यू विल डू, यू विल पुट इन द एंडोट्रेकियल ट्यूब, कल बात की थी इसकी. एंड देन यू विल आल्सो स्टार्ट चेस्ट कंप्रेशन. एंडोट्रेकियल ट्यूब डाली, देन पॉजिटिव प्रेशर वेंटिलेशन दिया, स्टिल हार्ट रेट इज नॉट पिकिंग अप. You will start chest compression, and here comes the role of D that we have discussed, drugs, right. Epinephrine we have discussed, we will not discuss. Second is the sodium bicarbonate. Sodium bicarbonate dose is, you can note down, 1 to 2 ml per kg. Dilution 1 to 1 in distilled water or 1 to 2 in 5% dextrose. Route, it's IV, and very slowly 1 ml per minute you have to give, especially when there is metabolic acidosis or Apgar score is still less than 3 at 5 minutes. What will be the effect? It will correct the acidosis, and as you are giving fluid, it will also act as a volume expander. Side effect हो सकता है if you give rapidly, intracranial hemorrhage. Ensure, this is very important because you are trying to correct the respiratory acidosis. The ventilation should be properly there. The child should be ventilating. Otherwise the effect will not be that good. What will be the response once you give? So usually in less than 30 minutes heart rate picks up, more than 100 हो जाता है heart rate. Now third is the drug volume expander. What is that? That is normal saline. Third drug which is used is normal saline. This is 10 ml, dose is 10 ml per kg, and you have to give in 5 to 10 minutes slowly. IV, when it is given, when it is poor perfusion. Poor perfusion कैसे पता चलेगा? When CFT is more than 3 seconds. Otherwise it should be less than 3 seconds. It is a volume expander and it will lead to better perfusion. Acidosis will also decrease with it, and response will be that in 30 seconds heart rate will become more than 100, right. So this is how in the algorithm you will be dealing with each and every case. In fact, every birth is an emergency because you never know When this child may not breathe, this child may have still heart rate less than 100. So any catastrophe can take place if child is not managed properly. Lastly, there are two contraindications to resuscitation. One is if less than 400 gram. Second is if child is anencephaly. So this is about neonatal resuscitation. If you want to ask, you can ask.